Welcome to our session on the role of partnerships in disease prevention and care. The achievement of health is a collaboration. It starts from the collaboration between the individual and the healthcare provider, all the way up to collaboration at global levels defined by global programs and initiatives such as the Sustainable Development Goals, international health regulations, etc. So in this session, we'll look at partnerships and their role in the new public health order for Africa. The fifth pillar of that agenda talks about trusted partnerships between systems, countries, institutions, professional bodies at local, national, and global levels. We will explore the private sector's engagement in the delivery of these partnerships, the diverse roles that the private sector can play. We will look at the role of partnerships in progressing technology, research, and innovation, and how private sector can be a main and is a major driver of innovation in the health and public health systems. We'll look at resource mobilization. How do we leverage the resources in the private sector to complement and contribute to the priorities developed in the public sector? And also, how do we look at sustainability of these partnerships? How do these partnerships lead to sustainable improvements in our health systems? And to do that, I have a panel of distinguished speakers who will talk about their perspectives and give us their views about this important topic, and hopefully also pose some challenges for the audience to interact with. Each panelist will have a few minutes to set out their stall, and then we will have a conversation, including inputs, questions, and contributions from the audience. So I ask the audience to keep note of your questions, hold on to them. When all our panelists have had the opportunity to set their stall, then we will get cracking. So it is my honor to invite these excellent panelists, and my apologies, I am going to read the bios because they're all very exciting and I don't want to miss anything out. So I'll start by my first panelist to introduce and invite to the platform is Dr. Abafele Cole. Dr. Abafele is the Managing Director of Organon SA, a global women's healthcare company in South Africa and Sub-Saharan Africa. And permit me to digress a little bit. I am very, very passionate about gender equity in health, and so I am particularly excited to have a managing director whose whole organization's focus is about women's health. So I'm really excited. So I'll go back to his bio now. He's a clinician, because a clinician is always a clinician, even if they're not in active practice. He's a clinician in the field of surgery and had over 15 years' experience in the pharmaceutical industry, having served in various leadership roles. Highlights include Vice President, Commercial Head, Sub-Saharan Africa, Group Medical Executive and Director, Medical and Chief Science Officer at various multinational pharmaceutical companies. Abafele holds an MBBS or MBCHB from UCT, as well as an MBA from UCT's Graduate School of Business. With Organon, Abafele is committed to finding impactful and innovation solutions to meet the healthcare needs of women in Africa. Welcome to our panel. Please come and take a seat. Those of you who know me also know that I have a policy that I never participate in a panel, and having a female moderator alone does not change, doesn't count. So I'm very pleased that we do not have a panel, and we have not had any panels in the 2 days of this symposium so far. So I think we need to recognize that. Thank you very much. So I'd like to invite to the stage Jessica Chivenge, Chief Strategy and Commercial Officer for Vitality Group. Sorry, did I pronounce your surname properly? Excellent, great. So Jessica currently works as Chief Strategy and Commercial Officer for the Vitality Group, the international division of Discovery. She was previously Chief of Staff to the CEO and Deputy CEO of Discovery Health, a partner market executive for Ping An Health, and a business analyst focused on the delivery of digital solutions to address a broad range of business challenges and opportunities. Welcome to the stage, Jessica. Jessica holds a postgraduate diploma in Management and Business Administration from Wits Business School, a postgraduate diploma in Legal Practice from Nottingham Law School in the UK, and a Bachelor of Laws from the University of Surrey. She's currently pursuing a LLM with Nottingham Law School, focusing on ethics in healthcare. So we might be putting some questions to you about the legal perspective in partnerships. Our third panelist is Professor Morgan Chetty, founder and chairperson, Healthcare Federation of South Africa. Professor Chetty is a leading expert in health policy and management in South Africa. I think that's limiting, actually. He's a leading expert across the continent, not just in South Africa. He is the founder and chairperson of the Healthcare Foundation of South Africa, a non-profit organization that advocates for quality and affordable healthcare for all South Africans. This is a very topical issue, of course, not just in Africa, but across the globe, as we talk about universal health coverage and how we can achieve that. He has over 30 years of experience in the public and private health sectors and has received numerous awards and recognition for his contribution to health reform and innovation. Welcome to the panel. And our final panelist this morning is Dr. Alan Pamba, Executive Vice President of Africa Roche Diagnostics. Alan was previously an independent global health consultant, is the Executive Vice President in Roche Diagnostics Africa, and is based in Nairobi, Kenya. Alan's role as a member of the Roche Diagnostics Eastern Mediterranean and Middle East and Latin America leadership team is focused on driving Roche investments in Africa through engagement with national, regional, and global stakeholders. Alan has exceptional knowledge and experience in the multinational pharmaceutical industry as well as in the hospital sector. He began his career with GSK as clinical lead and subsequently held several positions with increasing responsibility, including Director for Public Engagement and Emerging Markets, Vice President and General Manager East Africa, and Head of Government Affairs Africa. Prior to joining Roche, he was CEO of Nairobi Hospitals. Alan has worked in the UK, the US, and in Kenya, so he's truly a global citizen. Holds a Bachelor of Medicine and Surgery and a Master of Science in Public Health in developing countries. Welcome to the panel, Alan. So that is your panel for this morning, and in order to optimize our time, I won't talk anymore. I'm just going to sit down, and I will invite Dr. Abofele to start us off.
Well, good morning, ladies and gentlemen, esteemed colleagues and honored guests. As you've heard, my name is Abofele Kwele, and I represent Organon. Organon is a recently formed global healthcare company whose focus is fulfilling the unmet medical needs in women's health. Now, yesterday, in an informal meeting with Her Excellency, the Honorable Cecily Kariuki, I was the only man among 4 women, and she jokingly commented that healthcare is about women. Now, we couldn't agree more, because in our communities, in our households, and across our African continent, women are the primary caregivers and the healthcare decision makers. And in the words of the World Health Organization's Expert Commission, women's health is the foundation for social and economic development in the African region. We have seen in the HIV and the COVID pandemics, and as we're seeing now with the non-communicable disease as well as the oncology epidemic, besides the social burden, women also bear the brunt of the disease in both healthcare as well as economic senses. And while the 5 pillars of Africa's new public health order are a comprehensive approach to healthcare on the continent, with Dr. Abere's kind permission, I would like to focus on the 5th pillar, which is the action-oriented, respectful partnerships. Now, a little over a year ago, I stood in front of many of you at AHP 7 in Nairobi and called on all of us to take action and urgently address the lack of access for women to appropriate care, as well as the interventions that address their unmet medical needs. Now, this call had an overwhelming response, and in particular, I would like to acknowledge my industry colleagues at Hologic and BD, who have co-collaborated under the guidance of AHB as Secretariat in the formation of the Coalition for Women's Health in Africa, or COHA. Now, COHA is an initiative whose mandate is to advance healthcare across all spheres of society and to all corners of our continent in order to shape our tomorrow and influence the improvement of the medium to longer term outcomes of the healthcare of women. But given the breadth, depth, and scale of issues in women's health, and the recognition that no individual sector can do it alone, COHA is a vehicle that brings together the public and private sectors, civil society, NGOs, and multilateral organizations in action-oriented and respectful partnerships that are focused on positive health and social outcomes to bring a healthy and prosperous future to the African continent. One of the key obstacles identified by COHA was the lack of sufficient data on women's issues, what is commonly termed the gender data gap. And equally important was the lack of access to data that is already available due to individuals and organizations playing gatekeeper to information. But as the African proverb says, knowledge is like a baobab tree. No one person can embrace it fully. And so, after a short period of planning, COHA was launched in November 2022 in Addis Ababa with the intention of generating and sharing knowledge and research, raising awareness and generating dialogue to influence policy, and taking action for meaningful impact. Today, while only 6 months old, COHA has taken important strides to achieving its mission. But having said that, more hands will make light work. And we welcome all like-minded individuals and partners to join the collaboration and help us bring about the change. Now, Dr. Abere, in the minute that I have available, I would like to briefly touch on another pillar of the new order, public health order, which is linked to the partnerships and where Ogun is particularly active, which is investing in public health workforce. Around the world, the pharmaceutical sector is notoriously known as a consumer rather than an investor in healthcare human resources. Now, this is no different in Africa and leads to the gap in the workforce that is required for strong and responsive public health systems. Now, yesterday, Dr. Nikes showed us the numbers, and while these are quite grim, they are not insurmountable, and public-private partnerships are crucial in averting the crisis. Through a partnership with the South African government, the Talent Development Institute, and Unjani Clinics, Organon is turning the concept of farmer being scavengers on its head by capacitating health workforce in a similar manner to that described in Zambia yesterday. By supporting the training and deployment of community health workers as well as health promotion officers, the majority of whom are women, Organon is demonstrating the commitment to primary health care, health system strengthening, and job creation. Through health and non-health interventions, the private sector can play an important role. However, it is important for these partnerships to work, for the public sector to lose the mistrust that it has in the private sector. And similarly, the private sector must shake off its disdain for the public sector. The collaborations must be based on mutual respect and transparency for the sake of our continent. We welcome Africa's new public health order and actively seek opportunities to participate in achieving the objectives set out. Thank you.
So we'll move swiftly on to our next intervention. And Jessica, please.
I'm naturally quite loud, so hopefully I'm not shouting into the mic. As introduced earlier, my name is Jessica. I'm the Chief Strategy and Commercial Officer for Vitality Health International. Vitality Health International is one of many businesses that sits under the Discovery Group. For those of you who may not be familiar, Discovery it started off actually 30 years ago as a health insurer, and has since expanded into other lines of insurance, so car insurance, general insurance, and most recently a bank as well. I think what's been most important for us as we've expanded and what's made us different to other insurers is that we've always had a focus on enhancing and protecting the lives of our members. So preventative healthcare has always been at the very center of everything that we do as a company. So today I just wanted to quickly share our philosophy, why it's so important for the African continent, and some of the partnerships that we are driving to help us achieve those goals of, trying to drive preventative healthcare. So as I mentioned, we've been in the business for well over 30 years. At the core of that is something that we call shared value health insurance, which is about making sure that you might have insurance, but we're also focusing on making sure that we reward you for engaging in healthy behaviors, and as a result, we hope that you make better decisions and are better able to take care of your health, but it's also saving us as an insurer because you claim less and it costs us less. And we're able to take those savings and funnel it into strengthening public and private healthcare systems all around. And so we've successfully been doing this in South Africa for 30 years and have expanded into, I think, just over 40 markets, impacting 30 million lives globally, which is very exciting for us. Most recently, we expanded into the rest of the African continent, and we did that early last year. So we're in Nigeria, Kenya, Zambia, the DRC, and Mozambique with the same kind of shared value health insurance principle. And again, we are just very proud to be able to offer our services to people in a number of different industries. So what is this Vitality program that some of you may or may not have heard of that I keep mentioning? So essentially, one of the things that's quite important for us is in helping people to just kind of understand their healthcare personally. And once you understand where you are in terms of your health, you can then take steps to change your health, and we reward you for doing that. So we kind of pin it on three things. It's know your health, so screenings, going for checkups, going for tests. It's taking steps to improve your health, so exercising, eating healthily, and then we reward you for doing those sorts of things. In terms of the kinds of rewards, it could be 80% off gym memberships, it could be 25% off any healthy food items you buy in the supermarket, money off flights. The rewards that we offer our clients are super extensive. I think we've got hundreds of reward partners in South Africa, and the same for all of our other countries that we're in as well. And for us, that's what underpins the model of shared value health insurance, because if we encourage our members to be healthy, they stay engaged in being healthy, they cost us less, quite frankly, private sector, bottom line always a consideration, and then we're able to take those savings to give them more rewards and also build and strengthen the healthcare systems all around. So why is this particularly important for the African continent? A lot of our countries are starting to see, an increase in their socioeconomic status, which is great. But with that comes the ability to afford alcohol and all other kinds of unhealthy behaviors. So you start to see an increase in, people just becoming a bit more overweight, maybe not making the best choices. I am one of those people, so it's not me standing up there judging. You start to see an increase in BP, diabetes, and some of those non-communicable diseases. And at the same time, we know that we're in a crisis where we don't have the same number of doctors per 1,000 people or hospitals to be able to cater for what's becoming an increasingly concerning need. So I think that's why we're starting to see a much more big focus in prevention than trying to have to solve once someone has gotten sick. Another thing that's on the rise as well that we're quite keen to start tackling is mental health. So I will try my best not to scare people, but out of the top 30 countries in the world that are showing sort of high incidence of suicide, 15 of those are African countries. You've got over 100 million people in Africa that have a formal diagnosis, but you also have the challenge where we might not necessarily know that people have mental health conditions. And people who aren't in a great space mentally are naturally also not taking care of themselves physically, they're not going to be eating well, and so they're 60% more likely to be diagnosed with chronic conditions like, again, diabetes, high blood pressure, obesity, etc. So for us, it's a big concern, and we're starting to see an increased need for, again, screening for mental health conditions as well. And it's really just down to kind of how we behave as people. So from our data, we have seen that, the nature of risk is less about the external environment, and it's more about how we behave. So I'll give a couple of examples. Back in the 1900s, people died because of, the Spanish plague, or something that was just kind of a communicable disease that they had no control over. That's now kind of turned on its head, where 60% or 70% of deaths now are caused by behaviors. So we're smoking, we're not exercising enough, and those sorts of things. So that's actually where we have to start shifting why people are making those kinds of decisions, because it's having a huge impact. Same goes for whether, as I mentioned, we insure across different lines, so it's health, car insurance. We see that with drivers. 90% of accidents is about the way you drive. It's your behavior, not necessarily that the car is unsafe. Same goes for financial risk as well. So in cases where people are defaulting on their loans, we've managed to track it down to 5 behaviors that people engage in that cause them to default in their loans. And you'd be surprised the link between kind of your health and your ability to take care of some of your other responsibilities as well. Naturally, as human beings, we're quite optimistic. So a lot of us think we are healthier than we are. So you'll even see, on some of the slides, you might have 5 chronic conditions, and yet 52% of those people actually think they're in great health with 5 chronic conditions. So it's become really important for us to make sure that we help people understand where exactly their state of health is, and then take steps to address that as well. We are starting to see that early intervention is becoming more and more of a focus on the African continent. We see that the WHO is extremely active. I do stalk their Twitter accounts. And I check that they're doing a lot to raise awareness about certain chronic conditions. We're seeing a lot of government-led strategies, a lot of pilots being run in order to emphasize the importance of primary care and district-level care for people to become more aware of catching these things earlier rather than later, which has been great. And so onto the partnerships, the way that we see it. So I'm just going to run through 4 different partnerships. The first partnership for us is preventative screening. So all of our clients, we've introduced a policy where we come and we screen all of your employees for some of the major things, so your blood glucose. In some instances, for example, could be HIV, could be cholesterol, body mass index. And we found that because those are the 4 things that kind of lead to 60 to 70% of deaths worldwide, it's important for us to just help employers screen their employees, and we offer that within part of the package that they get when they have our products. Just to give you why we think this is particularly important, when we look at sort of just breast cancer specifically, we had our data in-house, we saw that by screening early and catching someone in stage 1 and 2 versus, say, stage 3 and 4 cancer, we're able to add six years onto their life on average. So again, the importance for us of screening becomes really, really, really important. So that's the first partnership. And again, by being on Vitality and earning points for going on these screenings, we've seen that over time, people actually tend to just engage in getting their screenings done before. So if you were like me and you're a bit reluctant in the first place, you start realizing that, I'm earning points and I'm getting rewarded for going on these screenings, let me just go, and it becomes such a natural part of your life. And we see that that's a trend that continues for years to come. So it's not like you do it for the first year, get bored the second year. It's something that you see over time. People continue to take up those kind of early preventative screening tests. Our second type of partnership is to partner with other, people who are also equally concerned with fitness. We've had some great partnerships with the likes of Apple Watch. With the African continent, we're partnering with Garmin. So if you don't have a watch, we'll say you get 40% off, which enables you to then start taking steps to become physically more healthy. And if you have any of the other brands, you can already kind of link your device to our app and start earning points and getting rewarded for taking healthier steps. We had a lot of success with the Apple Watch program where basically if you met your physical goal, you didn't have to pay for an Apple Watch. But as soon as you fell off meeting your goals, then you had to make a payment towards your Apple Watch. And we found that we were actually the number 2 distributor of Apple Watches after Apple themselves globally. And that's what's helped us to drive a lot of healthy change. And we've noticed that physical activities tend to trigger a healthier lifestyle. So once you're active, you start eating better, you're buying more healthy food, you're more likely to do your online screening assessments, you're more likely to go onto screenings in general. So that's been quite an interesting learning for us. Partnership 3, as I mentioned, we're very, very concerned about mental well-being. So we've been working a lot with mental health professionals to design kind of mental health pathways to see how we can better address some of those concerns. So on the app, you'll be encouraged to do mental health screenings. And then depending on where you are, we'll either recommend self-help apps or digital therapeutics, or we may then suggest that we actually refer you on into outbound patient care, and all of this, again, fully covered by your health insurance product. and we continuously reward you for engaging in that healthy behavior to encourage you to keep looking after yourself. I see someone standing, but don't worry. I'm literally on my second to last slide. She did warn me beforehand that that would be her subtle messaging. But basically, it's a win-win for all employers. Healthier people, more productive, they collaborate more. Smokers make more mistakes, FYI. And healthier employees are just generally more present. So that's what we found through some of our studies. And we'll be sharing these slides as well. And then lastly, thank you. We've got a partnership with Goodbye Malaria. Malaria is a big issue on our continent, and so what we're doing with these guys is, as part of our own SDGs and our commitment to making sure we have an impact in society, we're partnering with them to see what other initiatives we can do to help drive down instances of malaria. And that's that. Thank you so much, everyone.
Thank you very much, Jessica.
Good morning, all. Jessica, I just want to know, did you bring a Fitbit for all of us?
I'll let you borrow mine.
Good morning. I just want to make a preamble statement, and I think probably give you an overview of where I'm going to. I think the future is all about collaboration. And I think it's one word, collaboration, and that will mold the entire future. Solutions that we talk about, solutions is everybody's business. It's not funders and government's business, it's all of our business. One thing we forget, a partner that's so important, and this is my bias, is the patient. The patient is your main partner, and we often forget that. So I'm going to take you through this presentation, and what I'm going to show is just some concrete partnerships that are going on and the benefits of it. Yeah, so can I have the first slide, please? Yeah. This slide, just to tell you one thing. In the global targets, one statement that you should remember, that global target number 17 actually makes it very clear that the future is about partnerships. And it was done by the United Nations and the SDG goals, and I think it's very important, and you see it's a get-together of national governments, the international community, civil society, the private sector, and other actors. So it's not something that we're developing or thinking. It's there, it's stated, and we have a problem. By 2030, we need to get to a number of deliverables. Next slide, please. So the pandemic, we keep using the pandemic as, I don't know if it's an excuse or whatever it is. The pandemic has exposed a lot of issues. It exposed the vulnerabilities in our healthcare system, unpreparedness of our healthcare system, not the third world, the whole world, right? We've never been prepared for this. And I think it's important to say that if we need to have pandemic preparedness, it's all of society's responsibility. The United Nations Secretary General underlined the need for the world to recover better and ensure that we collectively, the word is collectively, remain on track with the long-term objectives. So the pandemic changes were sweeping across the entire world. It's triggered by the COVID-19 pandemic and underscored the need for effective partnerships. What did the pandemic show us? Is that we live in a global world. It's a global village. And we are all partners with everybody. It's not just the continent or just the provinces in South Africa, but the whole continent. And I think that's the important thing. We've got to understand that it's a global strategy we're looking for. And in 2019, the 2030 Agenda Partnership Accelerator was launched, and this accelerator was to fast-track the achievement of 2030 goals. So no government, no national government, anybody can address the present crisis of the future challenges in isolation. We need multilateralism, multilateral cooperation, and we need to work together. And that's been stated repeatedly. People keep asking me the question, and I think the chairperson will ask me the question, if I know all these things, why is South Africa not involved in a public-private partnership? But we'll talk about that later. So I'm just going to go through some examples with the limited time that I have to show you some of the partnerships and what it's achieved. We look at the Global Polio Eradication Initiative, the GPEI. It's a public-private partnership led by national governments with partners, the WHO, the Rotary, CDC, and UNICEF, and the Bill and Melinda Gates Foundation. What did it show? It showed a 99% decline of cases and an estimated savior of 1.5 million lives. And it also estimated that 16 million people were saved from permanent paralysis. This is a simple coming together of people. We have the Measles and Rubella Initiative was launched in 2001. And this initiative was led by the American Red Cross, the United Nations Foundation, the US Centers for Disease Control, UNICEF, and WHO. And it was committed to reducing measles deaths worldwide, and we've seen that this has happened really. The Maternal and Neonatal Tetanus Elimination Initiative, this was a partnership between the Global Alliance for Vaccines, Gavi, Save the Children, MNTE, which is the Pneumonic Fever Initiative, aims to reduce the mother and the child cases to such a low level that disease is no longer a major public health problem. We also have the Global Alliance for Vaccines and Immunization. I won't do too much of this with you. Gavi in 2000, and together the public and the private sector with a shared goal of creating equal access to new and unused vaccines for children living in the world's poorest countries. So Gavi draws on the strengths of its core partners and plays a role. So it's another partnership, right? And it's a partnership that's worked. Also, we have a partnership that I want to just mention here and not go through details that has shown tremendous amount of success, and this is a partnership for maternal, newborn, and child health. This is a list of global and regional partnerships promoted by the WHO. It'll be too tedious to go through each one of them, so if you read them through, you'll see there's UNICEF, UNFDA, UNESCO, UNEP, UNC, UNDCP, FAO, ILO. These are a number of international partnerships who have a proven track record, showing that partnerships is the future. So these partners will focus on promoting a healthy world together with governments and the private partners. I keep emphasizing private partners because I think we have to use the private sector, and we can talk about it in Q&A and the resources that sit in the private sector. This is another issue we can look at, is other initiatives like the Global Fund for AIDS, TB, Malaria. We see that recently, a week ago, 2 weeks ago, at the TB conference in Durban, one of the big issues that was raised was the role of primary care in screening and managing TB. And it's a big resource that we totally ignore. You don't have to go to specialized clinics. Now, this is my final slide, and what I want to show you, there's a demographic, epidemiological change in what we're seeing from infectious diseases to NCDs. We know that 58% of Africa is rural dense. Some people say 60 or more. We know that 40% of human resources for health are sitting in the private sector. I think it's much more than that at the moment. We also know that 60% of people across Africa seek health care. The chairperson was telling me earlier on, she thinks it's 70%. I'm going to agree with you. I think 60% to 70% of the people in Africa seek health care from the private sector. So why don't we realize the important role the private sector can play, right? So really playing this role. The burden of disease by NCDs is expected to rise in 2060 and be the major cause of morbidity and mortality, overtaking infectious diseases. So with the private sector being resource rich, it'll need to partner with the respective governments to both prevent the rising burden of NCDs and to treat effectively. So the healthy future can only be achieved by a PPP with the mission of leaving no one behind. And I end up with what I started with in saying, the future is all of society's responsibility. Thank you.
So our final intervention from Alan. So please, Alan, go ahead.
Good morning, everyone. It sounds so dull here. It's like a funeral. Good morning again. Okay, let's put some energy in this, huh? I'm sorry I don't have any slides, but I have one or two ideas that I would like to share. And then hopefully in the panel discussion, we will pick up. A number of points have already been mentioned. I remember Professor Shetty made me promise I will not repeat anything he has said. He has said a lot, so I'll try not to repeat. But anyway, as I was introduced, I lead Roche Diagnostics in Africa, based out of Nairobi. Roche is one of the leading global pharmaceutical multinationals, and unique in two ways. You know, the first way is that we have both a pharmaceutical and a diagnostics division. So we have a range of opportunity in terms of being a partner in healthcare delivery. And the second, which is a little known fact, is that Roche is actually the leading company in reinvesting revenue back into R&D. We put the highest proportion of our revenues back into research. And that speaks for the innovations that we bring to the market. In Africa, we're present in 12 countries, directly and indirectly in more than 40 countries. We have over 1,000 people in our team, and specifically with respect to diagnostics, we have a 10-year ambition to grow the number of tests that we supply into the continent 10 times. We call it the 10X ambition, which has 3 pillars in the strategy. The first pillar is foundational, and the investments we want to make are on foundational aspects, primarily on people, building talent internally, and also helping with some of what we hear about the health worker gap that we have in Africa. The second pillar is around driving access. And here we focus a lot on collaborating with different partners to create the right policy environment and also to find solutions to the many barriers to access that we all have, you know, to reach the patients we need to reach. And the third pillar is around innovative business models. So we're saying to get to 10X, we have to think out of the box, and we have to think together, work together in partnership to understand the environment and then come up with solutions that are hopefully sustainable. Now, if we take it back to our history as a continent with health, we have had a long history of a single epidemic of infectious diseases. Many of you will remember a time when it was all malaria, 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 and then it became malaria, HIV, and then malaria, HIV, and TB. And these were big problems. Many decades ago when I was starting medical school, I still remember a time when, you know, we had a big, massive problem with HIV/AIDS in the continent. As doctors in training, you could diagnose this with your naked eye, in restaurants, in the streets, anywhere you went. That's now gone. Is HIV gone out of the continent? No. What we've done is we've dealt with it. We've taken control. And, you know, patients who live with HIV now live a normal life, and they can live, you know, the lifespan that they were expected to live. And that's a big achievement. I use that as an example because that was achieved through partnerships. That could not have been achieved by the public sector alone or by the private sector alone. The collaboration that happens when we have a crisis globally is phenomenal. This being one example, COVID recently, to some extent, was also an example of how people mobilized very quickly. And the distinction between public and private became secondary. Yeah. Now, with respect to HIV, I use that as an example again because in Roche, over a 10-year period, in a partnership that we call the Global Access Partnership, that brings together PEPFAR, the Global Fund, and others, we have worked together, and today we deliver 60% of all HIV viral load testing in the continent of Africa. That is a huge achievement of the partnership, and we're very proud to be contributors through the innovation that we've been able to bring into that success. We now face a new epidemic in Africa, and you heard Professor Shetty talk about it, non-communicable diseases. I do not think there will be another global fund set up for that. And I think this is a situation where we really have to reflect and say, how are we going to face this new epidemic? There's no single entity that will solve it. Not the public sector alone, not the private sector alone. We must come together. We have no choice on that. We do, however, as has already been outlined a little bit by some of our panelists on the stage, we do, however, have to reflect on how we do the right kind of partnerships to succeed. There's a lot of suspicion, and it feels like there's a divide, public and private. I was talking earlier to Professor Shetty before we came up to stage, and he told me in certain circles in his country here, private sector is used as a swear word. It is so negative, you know? And I thought, my gosh, that is really strong. And it's true. You will never collaborate when you start there. This is the first point, you know? How do we treat each other with respect and appreciate what everyone can bring? Understand where the suspicion is coming from. What's the elephant in the room that we need to address so that we overcome that? The second point I wanted to make is that we need to examine the concept of partnership. What does it really mean? My experience, very often I have been approached in the different roles that I've had, you know, to partner on an idea. And it's ended up being, will you give me a grant to do this or a grant to do that? Just sign a check and give it. That's not a partnership. That's a transactional relationship, you know. It's not strategic. A true partnership means we are thought partnering on a problem. We may come at it from different directions, in my view, but we are fully invested in success, and we are all winning at the end. And there's no shame in you winning on the parameters that you're measured and me winning on the parameters that I'm measured. And I say that with caution because I know it brings in the primary focus that people imagine the private sector is focused on, which is money, which makes money a dirty word. And it doesn't need to be, you know? It's actually a dirty word until you need a grant, right? Yeah? It doesn't need to be. We shouldn't be embarrassed or ashamed of making profit. We shouldn't be embarrassed or ashamed of making insane profits. That's never right, you know, never fair in the world. But making profit, of course I will. That's what keeps us going. And I think by pretending that I'm ashamed about it, we will not progress because we all know at the end of the day, I will be measured on that as a performance indicator. You as a government official will be measured on impact. What impact have you had since you had this grant from the Global Fund or from anyone else on population health? I need to understand that as your partner in the partnership. And I need to be just as invested on your impact measure as you need to be invested on my impact measure. And then we win, you know, and then we win. And I think those are the hallmarks of true partnership. Now, I'm excited to be in the panel and to discuss and also to be challenged. You know, we welcome being challenged so that we find solutions that will help us deal especially with this new epidemic of non-communicable diseases. Thank you.
Thank you. Thank you very much. Thank you very much, Alan. So thanks to our four panelists for setting their stalls out and opening up the conversation. And I'm going to take moderator's privilege to pose the first question, and I'm going to be deliberately challenging. And so my question is, who's afraid of big bad pharma? Who's afraid of the private sector? And fear always has, there's an element of experience that leads and feeds that fear. What is it? Because if we don't understand why, we're not going to move on. And so, Alan, I'm going to come straight to you first and then go to Professor Shetty because you both talked about that resistance to engagement with the private sector.
Who's afraid of private sector?
Who's afraid of private sector? Who's afraid of pharma?
I will tell you a story very briefly, if I may. You know, in my former life, I worked for another pharma company not the present one. And we wanted to set up a collaboration with one of the leading NGOs dealing with children topics to save the lives of a certain time. I think it was 1 million children over a certain period of time. And we were going to leverage their understanding of the challenges and the resources that we could bring, and also innovation that we can bring to the solutions that were needed on the forefront. And I remember when the teams first met, there was a lot of resentment from the NGO colleagues. They could not understand why their CEO matched them up with pharma to find these solutions and work together as partners in a multi-year partnership. And we had to get, funny enough, we had to get a moderator to break the ice and get the team to work as one team and become a partnership. And the first thing they did is they put us, pharma guys on one side, NGO guys on the other side, and said, look, draw on a picture what you think of when you see the other. And the farmer guys drew a tree and someone hugging a tree. And then the NGO guys drew a very big fat cat with a briefcase. And they said, this is how we see it. And we all had a very good laugh, but that was the icebreaker, and we started talking to each other. That we all have certain ideas at the back of our heads that sometimes are the elephant in the room, and we can walk for years without putting the elephant on the table. I think we should start by putting the elephant on the table.
Thank you. Thank you. Prof, do you want to add to that?
Yeah, I think the fear is due to a few things. The first point is, it depends where about in Africa you are. If you look at the rest of Africa, the private sector is not as strong, not as developed as in South Africa. In South Africa, our private sector is very strong. But it's strong because it was allowed to get strong, right? So I don't think we should be blaming the private sector. If you don't regulate the private sector, you're going to get a sector that needs regulation. But I want to caution, the future is not over-regulating. You've got to be reasonable about how you regulate. That's the first thing. The second important point, I think, is that in healthcare, what's the difference? I think health is not a health agenda. Health is very much a political agenda. And I think we lose the plot. The last thing I want to say, and I hope I get a visa to go back to South Africa, I want to say is that, when you look at, if you look at the issues that there are, is when you vote somebody into office, into political office, when the person accepts his vote, he accepts the vote to become a public servant. You become the servant of the people, servant of everybody. We don't vote you in to take ownership of the country. So I think the people that have been voted in have got the wrong philosophy. They look at it as ownership. They don't see that they are the servants to listen to what the country needs. So I think it's not real fear, but it's fear that we developed by very poor kind of rhetoric that's not taking place.
Thank you. Dr. Bofele, I'd like to, you mentioned also mistrust between the public and the private sector. So, and I would like your perspective. Alan said something, and I am going to hold you to that, about the transactional expectation of, I want a grant, you give me the money, thank you very much, and you go away. And I think that is actually unfair. And I would like to ask you to actually defend the private sector perspective in these partnerships. What is your view of how we can... Trusted partnerships require mutual respect, mutual recognition of what each party brings. What is your experience there of what the public sector, in this case, brings to those public-private partnerships?
Indeed. No, thanks very much. I think just to take a step back in the context, I really do think that the mistrust that exists is not unfounded. I think in terms of our living memory as people in the room, we will remember how the HIV pandemic rolled out and how treatments were unavailable to many of us, many of our, on our continent, as a result of the profits and the chasing of money from the private sector. But of course, there's been a transition over the last 20 years of that, how that has unfolded. And we've seen how the private sector has come to the party to extend a hand in terms of collaboration. But similarly, the expectation is that the public sector also comes to the party in terms of providing an enabling environment that allows for the private sector to participate in these collaborations. It's important that governments recognize the role that the private sector can play and allows the private sector to play in these instances to collaborate.
Thank you very much. Thank you. I'm going to ask the audience to start preparing your questions if you haven't already. And do we have a roving mic? I have an extra one here. So we have a lady there and another lady there. And for balance, because I have been accused in the past of skewing too much towards women, I admit it, and I make no apologies. But I would like a gentleman as well. We have a man over there, right? So I'm going to ask one more question, and then I'll move to the audience. So, Jessica, I wanted to ask this question of you. You mentioned how your organization focuses on partnerships for health promotion, prevention, and early intervention, and your focus on behavioral change and behavior and influencing individuals to act differently to promote their health. So I want to challenge you a bit on that, because sometimes behaviors that individuals and populations engage in are driven by the ecosystem within which they survive and they function. So we have people who don't have access to fresh and healthy, affordable fresh food and healthy food, who don't have, giving them discounts of gym membership is not an option. They don't have the time or access to the gyms. So how can partnerships such as that your company offer actually help to create these health-enhancing environments that we need?
That's a great question. I think it's really important for us when we go into each country to understand that each country is nuanced. So there's no point me saying what's worked well in South Africa or in the UK is going to work fantastically well in the Democratic Republic of Congo. So whenever we've expanded into a new country, we've taken it upon ourselves to partner with local research firms to understand the consumers, understand the local context. We partner with local insurers to understand exactly what the risks are in that particular country or some of the challenges are. And we take those learnings and make sure that we tweak and design our products and our reward systems or whatever it is to make sure it makes sense for that particular country. I'll give you a funny example. I used to work for China, for a Chinese insurer. Same sort of thing. You'd say, oh, you're going to get yourself a free Apple Watch. The Chinese consumer actually doesn't really care about Apple Watches. They just want something that's really, really cheap. So then you need to partner with a Huawei device manufacturer, as an example, and make it more accessible for what makes sense for them. In a lot of African countries, we don't have supermarkets. So me saying you're going to get 25% cash back whenever you go to a supermarket makes no sense. If I'm shopping in a marketplace where I'm bartering and I get my plantain and then I get whatever I'm getting from the lady. So in that instance, instead of saying you're going to get points rewarded for buying in a supermarket, we might say upload a picture of whatever vegetable you bought at the market and you can still get your points. To your point though, because our solutions are quite driven by digital engagement, you could say, well, there's part of the population that just doesn't have access to a smartphone or doesn't have access to be able to get anything digitally. So how do we engage with those individuals? And again, that's where we have to be proactive and say, if we're offering a solution for a company that has, I don't know, guys on the road, like let's take a logistics company. Lots of these guys are truck drivers, are on the road. They don't have time to run around and go to the gym. How do you engage those particular individuals? You need to go to them. So instead of expecting them to come to you to do a screening, you go to them. So it's all about making sure product design and the way that we do stuff is tailored for each market.
Indeed. Thank you very much. So let's go to our audience questions. We have a lady there. Please introduce yourself and make your question brief so we can get as many.
Great, thank you. My name is Vuyam Jegula. I'm the External Affairs Director at MSD. So thank you to the panel and particularly for Dr. Pamba for putting the elephant squarely on the table. I think that's really important. Just one comment, I think, on that, rather than a question, and I apologize. I think one of the things that we miss, and I think Dr. Kwela also referred to this, that there's evolution. And sometimes, I mean, I remember having a discussion with a government official, South African government official, discussing the same issue of mistrust, and the same example was brought up, HIV, and the role of pharmaceuticals at that time. I said to her, if we engage on that basis, right, me and you sitting here today, do I have to raise the questions of all the government mishaps throughout the years? Should I talk about the approach to the initial ERD approach to HIV/AIDS management in South Africa, for example? Would I reflect on the various scandals? And should I look at you and say, that's government? I said, I can't look at you like that because you're you. Government is not some nebulous entity. It's made up of people. There are bad actors, there are good actors. And people evolve and organizations change. Today we look at ESG. The way business was done 50 years ago is not the way business is done today. Today, social responsibility, corporate citizenship is at the core of business. Let's allow each other to grow. Let's allow each other to evolve and engage on the basis of who you are talking to today as people.
Thank you. I think that's a really important point. Really important point. We do not build effective partnerships based on what we got wrong. We need to recognize that we're all evolving and learning, and we need to respect that journey on both sides. So it's both, pharma is not all bad, government is not all good, not all NGOs are tree huggers. Thank you. We have, yes, who has the mic? We have somebody else who has a mic. Yeah, go ahead.
Thank you. Good morning to the panelists and everybody. My name is Dr. Michael Reed. I'm Senior Director at Gilead Sciences. And what I want to talk about from a partnership standpoint is health equity. We know health equity being a state in which everyone has a fair and just opportunity to attain the best health. And the challenges that we face in Africa, say, for example, the recent punitive laws coming out of Uganda for the LGBTIQT+ community. When we think partnerships, okay, how can we contribute to advancing health equity using partnerships?
Who would like to take that response? Who would want to get off? Equity.
Thank you very much. I think equity is one of those critically important things in the healthcare sector, and is becoming an increasingly important topic that's discussed. And in our particular focus, gender equity is a part of access to health equity that is often not spoken about, and that we're really keen to focus on. Now, as the private sector, it is important that we focus on equity, and gender equity in particular, to address some of the important outputs and outcomes that we want to achieve. We realize that without addressing equity, we won't be able to achieve some of those things that we want to achieve. Now, in the setup of organizations such as COHA, that I mentioned earlier on in our discussion, one of the key pillars is ensuring that we provide the access to gender equity in access to health, as well as focusing on the equitable distribution of healthcare between urban and rural areas. And as we mentioned, because governments have got limited resources, because of the disparities that exist between urban and rural, between the various countries, it is important that we have partnerships with private sector. We have partnerships with NGOs that are able to get to grassroots level, understand what the big issues are, and we're able to address some of those outcomes, those issues.
If I could just jump in and add in as well, it's a great question from you, Doc. From our side, I think just a quick example of how we contribute to these types of partnerships and promoting health equity is that I think someone mentioned earlier, I think it might have been you, Prof, that said a large number of people, actually of healthcare professionals, are employed in the private sector. I think it's a scary stat, but Discovery alone probably employs the highest number of actuaries on the entire African continent, just the company that I work for. And so what we normally do is when we've gone into other African countries, we are getting approached by government saying, listen, we're trying to do increase access for all. There's a mandate for universal healthcare. We have no idea how to price the cost of an operation or how to set tariffs for what a doctor should be earning to do a particular procedure. And that expertise does tend to sit in the private sector. So we are engaging a lot more in helping them design programs to be able to take that $5 and make sure they max it out to be able to impact as many people as possible, because they don't have huge budgets, but they're not sure how to make it as efficient as possible. So,
thank you, Prof.
Yeah, just one thing, and I think that's the resistance we're having with the NHI in this country, is that to get equity, you have to have an unequal distribution of resources. And people don't want to accept the fact that you have to distribute resources unequally so that we can adjust equity.
Absolutely. I think that's a really important point. We need to remind ourselves that health is a human right, and therefore access to health care is a human right. And if we allow the rights of certain sections of society to be curtailed, we need to acknowledge, therefore, that we are allowing, in the long term, for our own rights to be curtailed. So advocating for equity is actually self-interest, because we need to recognize that it starts from one end and it grows from there. If we start to restrict access because we determine that one group of the population are more deserving than the others, then it'll only get worse for all of us. I think it's a really important point for us to consider in our partnerships, to ensure that we're always thinking who's been left behind and how do we ensure that they aren't. So we have one other question there.
Okay. Good morning, everyone. I'm Adrienne Leuser, Managing Director of Sanilux. I wanted to comment on a few points that were made, and then I have a question for Dr. Alan Pamba. So the first thing is with regards to the partnerships. Dr. Alan spoke about a win-win mentality, and I just wanted to add that it's with work that we do when designing partnerships, we usually talk of a win-win-win. So you always have to take into consideration the third win, and the third win is for the customer, in this case, the patients, those that are expecting these innovative solutions. So when you put them out of the table, then you have this fight, you have this mistrust. A lot of the things will be solved if we always take into consideration the third win as well, and really outline it and make sure that we keep that in mind and in focus. The second thing is also looking at the question that Dr. Pamba asked about how do we deal with the emerging pandemic or epidemic of NCDs. One of the solutions, I think, working a lot with the life science sector is, partnerships with biotech or life science startups. And then that brings me to my question. I'm aware, for example, that Roche acquired a South African biotech startup in 2015, Kappa Biosystems, that is really supporting in, developing some of their innovative solutions through, enzymes and the like. And I'm curious to Dr. Pamba, what are the key elements that Roche seeks when looking into potential partnerships with startups? And how do these partnerships align with Roche's pillar on 10x, or their 10x strategy, which is one of the pillars being innovative business models, including partnerships? And I really want to bring the focus to partnerships with startups for innovative health solutions. Thank you.
Thank you. Alan, I'm going to ask you to make that really short response and maybe catch up with a coffee break for more detailed explanation.
Yeah, thank you. It's a good question, and we will probably unpack it more outside. But, the considerations for partnerships, the principles are the same. Strategic alignment is important. We have a certain direction we're taking in Africa in terms of areas where we have expertise. Cancer, cardiovascular, infectious diseases, I talked about HIV. If you're within that space, it's aligning with where we're going strategically, so it's very easy. So that is one consideration. The second is we have to be clear that what we bring is the best solution for the goal you are intending for, so that we are an ideal partner for you, just as the reverse will also be true. So we try and match with the best that we can get to do the journey that we need to do, however big or small. And then, of course, we are very keen on innovations coming from bottom up in the continent. There's a lot of talent in Africa that is undiscovered. So again, in the partnerships that we're doing, increasingly, preference is local partners who have an understanding of the local environment that sometimes we don't possess, and a passion for success, patient outcomes, as we do. There may be other considerations that, may be nuanced to the particular case that we're looking at, but those will be kind of broad principles.
Thank you very much. And regretfully, we're out of time, so we're going to have to bring this session to a close. So the key message that I'm taking away from our brief discussion here is that there is enough need for all hands, and the partnerships are how we enhance the inputs that we bring as individuals, as individual institutions, as different sectors, and that all sectors add value to those solutions that we're trying to create. We need to acknowledge that all parties bring something to the party and to the partnerships. So it's not just pharma bringing money. Government brings stability. It brings access. The NGOs bring advocacy. And the patient, we need to remember that at the center of all our partnerships is the individual in the society whose health we aim to improve. So effective partnerships require balance. We must all see what each other brings to the partnership. Unidirectional partnerships where one person is a giver and the other is a taker does not result in sustainable and effective partnerships. So with that, I'd like to ask you to join me in thanking our panelists for their contributions this morning. And to thank AHB for this very interesting symposium. I've learned so much, and I'm looking forward to the rest of the sessions as well. So thank you.